Welcome to Pause for the Truth, where you can sit back, relax, and hear an honest dialogue about health, wealth, legal, and social issues. The hosts are Dr. Rogers Kane, family practice physician, and Jocelyn Turner, health education consultant, with co hosts from the Northeast Florida Medical Society and its foundation. Stay tuned for the truth about matters affecting you and your family. We're here to tell you what's really going on and why. Good
There we go.
evening and welcome to Pause for the Truth. I am your co host, one of your co hosts, Jocelyn Turner.
And I'm the other co-host, Dr. Rogers Kane. I think we're having some stability issues as far as our podcast is concerned. Our podcast host, Lisa, says to me, StreamYard is having some stability issues. The studio instability issues is what it's saying that I'm looking at.
Yes.
So there's a storm headed my way. It's thundering out. So I
Right.
don't know if that's what's happening
Can't
in
say
my
I
neck of the woods, but
studio, but let's get to it because we got Dennis there. Dennis here.
I'm blessed. I'm back. I'm back, Dr. Kane and Tyrone. It's a storm headed my way, so hopefully I'll stay on. But again, good evening.
Yeah. Boy, we having some instability issues right now. We're not sure what's going on. I thought it might have been from the provider of our for our services, StreamYard, but I'm not sure if that's the case. Tyrone may be able to speak to it.
Right. We did get a notification that said that with the updates of our new StreamYard, as we seek to continue to give greater and better
Yeah, yeah, it's very unstable. Um, Look like I'm the only one that ain't getting cut out so far. I may
So
get
that's something happening with StreamYard, Dr. Kane?
yeah, it's StreamYard, a podcast provider.
Can you?
Yeah, because even I guess it's coming in and out. And
Yeah,
Tyrone.
it's caused because of the backgrounds. So it's an issue that they discovered when you use a virtual background.
Okay.
So I'm gonna
So
turn my ver-
so with that being the case, we apologize to our listeners for this evening, and our guest that's coming on. And look at our technology guru is even having issues coming with it. So even he's coming in and out. Look like I'm the only guy that's stable so far. I'm not being spoke too soon. Miss Turner, can you hear us?
Yeah, so what I did since he said that the issue.
Nope, that wasn't it. All right. So let me see if I can get Dennis in. Add him to the stage.
Hello.
Hey, Dennis, we got you. We're having some stability issues with our provider. Not sure what's going on. They did a new, um, supposed to be an upgrade. Don't look like it's being upgraded.
Well, yeah, they found that there was an issue when you have the virtual background. The
Okay.
virtual background is causing viewers to get kicked out. So, Brother Dennis, I see you've got a virtual background. So that's one of the reasons that you're probably being kicked out. If you don't mind, you can turn that feature off, and hopefully we can keep you in. They are working on it and hope to have it completed and repaired by our next broadcast.
Yep. There you go.
I think
Disconnect.
he just put himself down, so he's going to
Try to get
change
that.
his background. Miss
All right.
Jocelyn, I see you just blurred yours instead of using a virtual.
Yeah. Maybe we should have
Yeah,
told Dennis blurred and
I
that back.
thought that I thought you were saying that using a virtual background is what helped. But anyway, so to our listeners, sorry for the technical difficulties. Hopefully we won't get cut off again. But tonight is a special evening. We are partnering with the Jacksonville Urban League, and starting at 7 p.m., we're going to simulcast their town hall meeting on healthcare access. So hopefully this will work. We won't have any technical challenges. We'll log off while Tyrone connects to the town hall discussion. But in the meantime, before we get started with the town hall, we do have Dennis Stone, the director of the Center for Advocacy and Social Justice with the Jacksonville Urban League. Dennis, hopefully you can.
Yeah,
Hopefully Dennis will be chiming in, but I'll go ahead. Oh, there he is. So,
you can
Dennis,
blur
in
the
about
background.
less than 10 minutes, tell our audience a little bit about the Jacksonville Urban League Center for Advocacy and Social Justice. I guess I'll have to tell the audience a little bit about the center
Yes.
town hall meetings, but the Center for Advocacy and Social Justice is going to be hosting. Oh, there he is again. Well, I tell you what, technology is something else. Either you have it or you don't. And
Can you
there's
hear
only
me?
so much. There's
Yeah, we
only
can
so.
hear
Yes, we can hear you, Dennis. Go ahead.
Yes. So the Center for Advocacy and Social Justice at the Jacksonville Urban League has been around since 2018, and in 2020 we had our first uh, center interns start, and so we've been doing this for about 5 years. We have interns from all over the country, um, in working in a number of subjects: criminal justice reform, public health, education, anything that needs advocacy, you name it, they work on it. And we have a particularly exciting group this summer working on a number of things. And we have a series starting next week of town halls, in addition to the one this evening on public health and our monthly conversation on racial healing and reconciliation, which will be on this Thursday. Many of the interns write a policy paper, and then they look for a speaker to be on our virtual town hall. And we have a number of them, uh, as I said, in the next couple of weeks. Next week, we will be having two on what it's like to go to law school. Some of our pre-law students are putting those two on. And then there'll be focus on other topic areas that are important for advocacy, including immigration and the impact of immigration changes, put it politely, in Jacksonville. What the impact is going to be in Jacksonville of that, and so it's an exciting group, an exciting program we've got going, and we're looking forward to partnering tonight with the Pause for the Truth as you join us in our program this evening uh, that will cover access to health, featuring Lynn Sherman of the Mayo Clinic, but assigned to the mayor's office and has been doing a great job organizing a response to community need. And I'll pause there and turn it back over to you, Jocelyn.
Dennis, a quick question for you regarding your public health interns. You mentioned that they are from all around the country. Are most of them actually, I know you're a lawyer, but are most of them attorneys, or are they in various professions, just with public health being the foundation of the work that they're going to be doing in the future?
Actually, that's a really good question. We have students from law schools, from undergrad, graduate schools in a number of topics, everything from AI
Mm.
to education. But the public health group are by and large made up of public health students, either undergrad or master's students, all studying in public health. And interestingly enough, most of them got into it when they discovered that they were interested in some form of social justice. But when they got into college, they realized how significant the need was for public health. And so they gravitated towards that. And thus, many of them have a social justice bent and are interested in advocacy.
It'll be interesting, Dennis. Thank you. It'll be interesting to see when you talk about advocacy and social justice and public health, just merging all of that. It's exciting to me, of course, after, I spent almost 4 decades in public health, but to the conversation that's happening now after the flooding in Texas, some folks have said that there were some breakdowns. Obviously, we don't know the full story and don't want to speculate it because we certainly um, acknowledge the fact that many people lost their lives, lost their homes, and it's just been a total devastation. So I like when young people step up because they offer solutions for the future, and they look at what's happening now, and then they volunteer outside of school and really delve into the communities where they serve. So, what made you all start with the town hall series for this summer? Why did you choose to, or did they choose to start with access to healthcare as the first in the series of town hall discussions?
Well, beginning with COVID, we started to get a lot of public health students in our program. And so every semester, and I include summer as a semester, uh, has a component of public health. So, and among those students, they have different interests. Generally speaking, they're interested in maternal health, of course, infectious diseases and the impact on society, and access to health. And that's particularly of note now because of the changes that have been happening at the federal level.
That's exciting. Dennis, not to put you on the spot, but you do such an amazing job. You've done an amazing job building up that internship program, but you've been a professor for a long time, haven't you? Really having an interest in teaching the next generation of professionals.
Yes, and in fact, I was thinking one answer to your question about public health and advocacy. Over 40 years ago, I was at a cocktail party where there are a lot of doctors, and the doctors were just asking me all kinds of questions, and it hasn't changed much at all. Many physicians and others in the health professions, nurses, what have you, really are they're afraid at times as to what the law is going to do to them, and you know these days that's even more so with the changes that are going on. So um, it's always an interesting intersection, and thanks to my engagement with the public health professionals here in this city, I've gotten into the political determinants of health and that the impact that those political determinants have on policy, which in turn impacts um, social and medical policy.
Yeah, I know one of the discussions we've had in the past when Roe v. Wade was overturned, we talked about providers and feeling that their license might be in jeopardy if they continue to provide certain services, and the fact that care to some women may go untreated and folks may have to get their care in other states. So people don't think, Dennis, of the intersection between health policy and health care. And so it's always a good time and a good opportunity to have that discussion. I know you need to make that transition to get ready for your town hall. So we'll let you go ahead and check off if there's nothing else you'd like to say. And we'll see you, to our audience, as we said at the beginning, we're going to migrate at 7 o'clock to the town hall discussion, the Jacksonville Urban League's town hall discussion on healthcare access. So, Dennis, any parting words before we see you at 7 o'clock?
Oh no, just congratulations to you and Dr. Kane and Tyrone for this great program that you put on. I'm a subscriber and I look forward to seeing those episodes show up on my YouTube screen. So congratulations for what you've done. And I look forward to coming back and engaging in more conversation.
Thank you.
Awesome.
Thank you so much, Dennis. So we'll see you soon at 7 o'clock. So to our audience, thank you again, as usual, for tuning in to Pause for the Truth as we get ready to embark upon the discussion of talking about healthcare access. Each week we delve into different topics, so it'll be interesting to see the way the discussion goes tonight. But Dr. Kane, you've been pretty vocal about some of the changes that are coming down the line, and I know I was talking to someone today who's talked about the changes that's happening with their elderly parent related to uh, some services that they've been receiving. And now they are getting notification that because of changes in policies and funding and so on and so forth, that those services were not going to be made available to this individual's elderly parent. Have you heard anything from your patients about any notifications that they've received since these new changes have occurred in from the federal level?
Well, some of the patients have been discussing um, what their fears are because that the BBB, the big beautiful bill, was just passed Friday. Um, they haven't seen is the I guess the actual public health uh, institutions have not come down to filter down to the user level like they will be soon. Okay, we're hearing about it from some of the um, entities, much like what you discussed a few minutes ago, in terms of services that these people will be providing, including a lot of the like Alzheimer's care, um, Meals on Wheels, Head Start, which we've discussed about that already, and a lot of those things involve healthcare. And healthcare is a very general term, and from what we see here on Pause for the Truth, because if your money ain't right, your chest get tight, and so it can be, having chest pain as a result of fears that have been funneled into that individual about what they may not be able to receive, and they be independent on. We hear about the changes in Social Security, and that's causing a lot of my patients a lot of fear. They're very fearful of not getting their Social Security checks either on time or at all from that standpoint. Okay, and then, of course, if you see any patients that are of Brown persuasion, especially, they're fearful about what may happen to them if ICE shows up at their front door, even though they may be legitimate citizens. At least from previously before this administration, we say they were either natural born or naturalized, and so some of the naturalized citizens are being very, very um, threatened and fearful of what may come down. We're already see, and I got a lot of patients. If we're talking about access to healthcare, I got a lot of patients. I was already seeing issues as far as having access to um, specialists and even primary care, because that's a primary care shortage, and a lot of that is being supplemented with APRNs, and there's nothing APNs, whichever state you're in, and how they made the name them. But a lot of that is being supplemented by uh, healthcare extenders, not necessarily physicians. And there's nothing wrong with that because I know a lot of very good, smart APNs, but even that, they're sending out a bunch, graduating a lot of people. Sometimes they really ain't up to par in terms of compared to some of their own peers. Really ain't up to par because there's such a shortage in it. There's one place here in town, they don't have a single doctor, but got maybe 13, 14 APN, APRN. And so
Hmm.
I'm not saying they have diminished health care, but our generation used to seeing doctors. They want to see doctors, and that's not one of those things where I'm giving myself a pat on the back because I am. It's just a matter of what patients expect, especially older folks. They set in their ways, and some of the things that they're asking for and requesting, they expect to see a physician at some point in time. A lot of them say, "Hey, I don't mind seeing them sometime," but at some point, you want to see a physician just to kind of, and from their perspective, they may want to validate. That may be some level of validation for them in terms of their health care.
Yeah,
But
there was a comment, Dr. Kane, about a notification was sent to through some senior centers about services will be changing and more details were coming soon. I know someone was talking about their disabled relative. They're concerned that services to them will be threatened, and also people who have relatives who are in living facilities, whether or not they will be able to keep those individuals in those places. That's why the Center for Advocacy and Social Justice at the Jacksonville Urban League is so important. If you don't know how to advocate, then I would say reach out to the Urban League, because they can talk to you. Dennis Stone, again, talk to you about the processes that we have as citizens as we want to advocate. And obviously you can start with voting. We always talk about the importance of voting, but oftentimes people don't know who to vote for. And so we've tried to, through this platform, educate people, not advocate for people, but educate the process for voting, but also making sure that you show up at these meetings when the people who are running for office are running, and have your questions, even in advance of this town hall discussion that's happening at 7 o'clock. Go ahead and have some questions in advance that you may have. We always do our homework behind the scenes. And so knowing that there are always communities, Dr. Kane talked about access to care. I know I've had several physicians. Jacksonville is the largest city and landmass in the nation. I've had several physicians who were within 5 to 10 miles of my home, who are now 15 to 20 miles from my home. So now I'm okay with traveling, but I've had to take my elderly relatives further for their appointments. So that's the kind of thing that people have to think about. We always talk about who should we care for the most, the babies and the elderly. Position them. Elderly people are already feeling some kind of way that their independence is being taken away, but at least they could drive to their primary care doctor's office, or go to the nearest senior center for some socialization skills. Again, if you're just tuning in about 5 minutes, we're going to transition over to the Jacksonville Urban League's Town Hall discussion on healthcare access. Tyrone, there was another comment that was placed, that someone wrote. I wanted to acknowledge that many of the Hispanic patients who had temporary protective status are missing their follow up appointments. And just imagine, so those folks are going to be home. They could be, deathly ill, if you will, if they're not getting their medications for their high blood pressure or their diabetes or whatever, right? And so this is going to get
but
really serious
yeah,
soon.
Yeah,
yeah,
and one of the things that's important for us to know, the shows like Pause for the Truth and other places that advocate, this is a time in our present that understanding what's going on is more important than ever. See, there were times when you can just sit back and relax and let it happen, and everything was said and it was going to be what it's going to be. But the landscape is changing ever so quickly. So it is important for everyone to be not only plugged in, but involved. We talk here all the time about getting out to vote. But we also now have to talk to you about following the news and doing your research to see what the effects of what comes down the pipe is going to have on you and your loved ones.
right. Yep, yep. I mean, and that's your barriers include anything from not just provider shortages, but geographic barriers, as Jocelyn mentioned, the location of the closest physician to an individual. For those of us who can still drive and maneuver through Jacksonville, as busy and as much road that we're acquiring, that it's easy for us. But that elderly person who says, "Dr. King, I live right down the street, so I'm happy I can just drive right to your office and I don't have to get on the highway." There are things like uninsured and underinsured individuals. Medicaid is going to be a big issue right now because they're getting ready to take away 800, almost $1 billion worth of Medicaid services, and that's going to affect the Affordable Care Act because a lot of the Affordable Care Act was joined at the hip with Medicaid. Mental health access is going to be an issue. There's always that technological or digital divide that separates, a lot of times separated by generations, um, in terms of the ability to maneuver and matriculate through these digital technical barriers that may be set up pretty soon, or extended pretty soon. And these people may not be able to reach it. Systemic racism has never went away. It's still a big issue right now, and it's getting even worse because racism was always there, but now they feel like since the cover has been peeled back, that it's okay to be a racist.
Yeah, I know when you talk about who's most affected or potentially, you talk about low income folks, rural residents. There are many people who live in rural communities who right now have a shortage of providers. You can only imagine that it's going to get even more critical. I know in one of our counties, they don't even have an OBGYN. They have to travel outside their county to go to another county in order to have a baby. So it usually is scheduled.
I think
People of color, LGBTQ plus individuals, immigrants, again, people with disabilities, and older adults, especially without Medicare, Medicare Advantage, or what have you. And so again, as Tyrone said, it's now more critical than ever that you stay plugged in, know that you have a voice. If you don't know how to advocate and get involved, start plugging in, tune in to Pause for the Truth every week. Tune in to these upcoming town hall meetings that the Jacksonville Urban League is having, starting with tonight in about 2 minutes. We're going to transition over to their town hall discussion on healthcare access. Tyrone or Dr. Kane, are there any final thoughts you have regarding healthcare access before we transition to the town hall?
I think the only thing that I want to say is that rural hospitals closing, a huge number of them may be closing simply because of funding and lack thereof from Washington, D.C.
Tyrone, anything else you'd like to add before we transition?
No, I think it's a good time for us to of course plug the show and say that we like for all our viewers to continue to go out and like us on Facebook and become subscribers and followers on all the media. But the truth is that one of the things that this show was set out to do, we continue to do, and that is to inform people about the changes in the landscape in the minority community. So we're not the only ones out there doing it. So just keep connected to sources of information so that you can make wise choices for you and your family.
Thank you, Tyrone. And if you are in Northeast Florida, you might hear the rumbling in the background where I am. It's about the storm. Don't forget to be storm ready. Have your hurricane kits ready, just in case a storm is happening. Non perishable food items, water. If you have pets, have enough dog food for several days. In addition to human food, pet food, water for yourself and for humans, as well as water for pets. Have your medications handy. Have a list of your medications. Email that list of medications to someone else, and so that way you will have access to that email at all times, and somebody who doesn't live in your city will have a list of your medications in the event a storm happens in your community, because you can't just say it's the little pink, red, oval, whatever pill. You need to make sure that you know what medications that you're taking, the frequency that you take them. So thank you for
So
tuning in, and we're going to now transition over to the town hall discussion. And as Tyrone said, don't forget to subscribe to our YouTube channel. Thank you.
Lynn Sherman, Executive Director of Health Programs at the Mayor's Office in Jacksonville. Really looking forward to her presentation, and
Well, Dr. Kane, it seemed like a great idea for us to tune in to the town hall meeting. Are we going to have to continue on with our discussion? We were trying to simulcast with the Jacksonville Urban League's town hall discussion on healthcare access tonight. Here we go. So hopefully we can get that going. Thank you all to our listening audience for your patience.
That's happening in our government as a result of the BBB. And many people are being impacted by it, from SNAP to Medicaid, and other ways that people get health care. But I think, and one of the most innovative things that have changed how we get health care is telehealth and telemedicine. It's really important to how we serve every citizen in our community. And so I think it's really important that we include that in how we deliver healthcare.
Rosanna?
Thank you for that. I didn't realize you have a slideshow to present, so if you do want to go ahead and start with that, then we can move over to the questions. Sorry.
Okay, thank you, Natalie. Thank you, Natalie. So, as was mentioned, I'm Lynn Sherman, and I have the pleasure of sharing with you all what we're doing here at the city in terms of health and well-being, and just to give you a snapshot of what is happening and what the needs are when it comes to health in our community. And so I look forward to sharing this with you. Jacksonville, a beautiful Jacksonville, that is what you're looking at now. Our city and all 875 square miles with beautiful beaches, accessible rivers, town centers, shopping, and simply amazing bridges in our community. We even have the Jaguars. We have the Jaguars and a stadium that will hold up to 72,000 people in it at some point when the new stadium is built. And as Jacksonvillians, we're all excited about this. But Jacksonville, even though it's a great place to live, a great place to work, and a great place to play, we are 16th place, the 16th best place to live in the U.S. We're the 6th best place to retire in the United States, and the 3rd hottest job market in the United States, according to the Wall Street Journal, and the 2nd fastest growing city since the pandemic. And that's according to Economic Innovation Group. So the University of Wisconsin county health rankings are provided for each state. And let's take a look at Florida. Florida, with 67 counties, ranks 46th in health outcomes. Recently, they decided not to give a number when it comes to ranking, but to indicate where they fall on the spectrum. Are they at the top of the healthcare list, or are cities and counties in the middle, or are they at the bottom of the list? But Duval County falls right about in the middle, around 46, and it may have slipped up to about 47 here lately. So why is that important? Health outcomes represent how healthy a county is right now in terms of length of life and quality of life. Duval is ranked in the lower middle range of counties in Florida, somewhere in the 25% to 50% tile. Health outcomes are ranked based on the length of life. We're all expected to live to be about 75 years of age. It's the gold standard here in the United States. The premature death rate is calculated over a 3-year period of time, and this one is from 2018 to 2020. So we should be getting some new calculations here pretty soon, but these are the latest calculations that are available. It measures the number of life years lost per 100,000. What that means is that if someone passes away at the age of 70, that is considered 5 years of life lost. If they pass away at 1 year old, that's 74 years of life lost. So you look at the number of years of life lost, multiply that by the population, and divide it by 100,000. That's how you get the number of lives lost in our community. So in the United States, the premature death rate is about 7,300. 7,300 of years of life lost per 100,000 population. Think about that. Hold on to that for a second. In the state of Florida, it's 7,500 years of life lost per 100,000. Let's take a look at those social drivers of health. 80% of what make up health is not related to what happens in the office, at the doctor's office, in your doctor-patient relationship. When you look at health outcomes, only 20% of that comes from the health care you receive from your doctor. The other 80% comes from your physical environment. Housing, transportation, air and water quality, income plays a huge role, and so does community safety and employment, education, and health education. All of those things are included. All of us, all of these things play a role in whether you are getting the appropriate level of health. This is why we talk about the social drivers of health. These are very important to the health and well-being of citizens here in Jacksonville. Getting more doctors or more healthcare providers and health organizations is not the problem. We have to focus on the other 80% that affects our health and our well-being and here in Jacksonville. Let's break a couple of things down by zip code. Let's start with education. You're looking at the percentage of population with less than a high school diploma. In the green areas, a very small percentage has less than a high school diploma. The red areas represent 30% of the population with less than a high school diploma. North and west of the river, there are more health issues where there is lack of education. And now hold on to that. Then we look at the percentage of the population living in poverty. If you put this map on top of education, you see that the same areas with low education rates are those living in poverty. They correlate with each other. Let's look at median income. Median income also coincides with poverty and is in the same areas where there's issues with low education levels. Let's look at percent minorities per health zone. When we look at the percent of minorities by health zone, the same thing is revealed again, where we see our minority population having the same issues north of the river or west of the river are having the same challenges, whether it's education, income, or living in poverty in this beautiful 875 square mile city. And then life expectancy. The health zones are broken down based on life expectancy. So in Health Zone 1, you can see the life expectancy at 71 years old. If you cross the river and go down San Jose, it goes up to 80, a 9-year life expectancy increase. And I believe that this here lately, that gap has increased. That's crazy. Something's not right about that. It does not have anything to do with the community, but it has everything to do with where resources have been distributed for generations. And you can clearly see that in the numbers. Life expectancy from birth is a summary measures of mortality that is used to measure geographic inequalities. Health Zone 1 has a 4 to 9 years shorter lifespan than all other health zones. Health Zone 2 and 3 and 6 have the longest lifespan overall. We have food deserts, where we have issues with income, education, and poverty. This is where there is no access to grocery stores where people can get fresh foods. However, there are plenty of fast food restaurants and minute markets that you can get something really fast and quick. There's one on every corner. You can't miss them. How do we assess a community? We assess the community by how well we treat our children. Our children in poverty has consistently been higher than the rest of the state and even the national average. We had a period of time where we were doing okay, but as you can see, we didn't stay there. Our infant mortality rates also correlate with poverty, education, food deserts, etc. There are parts of the community that do so much better than we do in other areas. So if you take a look at this graph, it shows infant mortality rates from 2015 to 2021. We're looking at live births per 1,000 and babies not surviving until their first birthday. That's how we measure infant mortality. It correlates with minority status, poverty status, income status, and education status, and prenatal care. So in the green, we're talking about 18 babies per 1,000 not making it to their first year of life. In the red, we're talking about anywhere between 0 and 5 babies out of 1,000. You can see that we've had some improvements in infant mortality over the last few years. However, 12 out of 1,000 babies born in Duval County last year died before turning 1. This is regardless of their socioeconomic status. This is a communication gap. We are 3 to 4 times more likely to see African American babies die than Caucasian babies. We know where we need to focus. Some of our attention needs to focus in those particular areas. Our current infant mortality rate overall is 6.1 in Duval and 3.5 for Caucasian babies and 12.4 for our African American babies. When it comes to uninsured rates, with the onset of the Affordable Care Act, which really kicked off in 2014 after they got some of the kinks out, more people are getting insured. The uninsured rate has decreased, but we're still worse off than the rest of the state and the rest of the country. This graph shows how our lost years of life started to separate further from the rest of the country around 2015. somewhere around 2012, our homicides were going down. Our homicide rates started to go down. Then that changed, and they continue to rise. So what happened? When we talk about calculating years of lost life, remember it's the number of years of life lost before the age of 75. When there's a homicide, who's dying? Maybe 20-year-old, 18-year-old, 25-year-olds. You just lost 50 years of life. When you see the violent crime and homicide rates increase like this, and we're continuing to lose young people in dramatic ways, dramatically increasing our years of lost life, it is directly tied to the health of our community. So again, 80% of what makes up health is not related to what happens in the office when you visit your doctor, or the relationship that you have with him, no matter how good it is. When you look at health outcomes, only 20% of what comes from the health care you receive from your doctor, and that's pretty low. The other 80% comes from your physical environment, housing, transportation, air, and water quality. Income plays a huge role, because if you don't have the money, you're certainly not going to go to the doctor to get health care, because more than likely you probably can't afford the majority of the copays. Community safety also is a problem. Employment, education, health education included. Health literacy is so critical, because it's so important that people in our community understand what that means to take care of yourself, what it means to be healthy. All of that plays a role in whether you're getting the appropriate level of health. This is why we talk about the social drivers of health. Getting more doctors or more healthcare providers is not going to make a big difference. That's not our problem. We can focus on that other 80% that we mentioned. So what can we do? How can we make an impact? This data is probably not new to any of you, and many of you on this call know what our challenges are with health and well-being. And hopefully, the majority of you have some idea of what some of those things are. So the question is, what are we going to do about it? What can we do about it? What are we doing about it? We can talk about things, but our mayor wants us to make an impact. Very specific about that. Dr. Sunil Joshi, who serves as our chief medical officer, and I have been bringing like-minded people together who share the same vision. We're bringing organizations out of their silos and challenging them to work together. This is our job, a big part of it. We're asking the community quarterback organizations to lead the charge. This is how we want to work together and move forward, because it's important. We must look at the big picture. We have to look at the big picture. We collaborate, communicate, and support everything they do to improve the health and well-being of citizens here in Duval County. These are the areas that rose to the top with our community members as issues that we needed to address right away. Access to primary care and dental care, maternal and child health, elder food insecurity, mental health and substance misuse, health insurance access, and the social drivers. So what are we doing? And I believe we're doing something pretty cool with this initiative. This initiative is designed to address access to health care, access to primary health care, a program called HealthLink Jax, which many of you may have heard about, I hope you have, that provides every person who does not have health insurance with immediate access to a doctor and a care navigator 24/7. That connects a patient directly to a physician. All you have to do, or anyone has to do, is call 935-CARE. 925-CARE. There's a big financial impact for helping people stay out of the emergency room Average cost of an emergency room visit is anywhere from $3,500 to $4,000 per visit. Every patient that calls is treated and connected to a medical home, coordinated by Jack's Care Connect. It's a partnership we have with them, who works with every safety net clinic in our area, all the free and federally qualified health clinics they're working with. Agape, Sulzbacher, Mass, Community Health Outreach, Volunteers in Medicine, Mission House, and other subspecialty cares such as We Care Jacks, who focuses on specialty care. So if we're keeping these people out of the emergency room and providing them with a service and embedding them into this primary care network, not only are we immediately saving taxpayer dollars, but we're getting them into primary care so we can prevent chronic health conditions. If they're seeing a doctor, they're not waiting until they get sick to see a doctor. They have a medical home, which is really important. So when they're not feeling well, they have a place to go. And it's so much easier for people to talk to a doctor sometimes, depending on where they live, where they are, and transportation can be an issue in terms of getting folks into a doctor's office. But if people who are uninsured can talk to a physician on their cell phone or on their computer, then we're going to have a healthier community, because we're going to encourage them to use that resource and help them to understand that it's not difficult. And once they try it, they really do make good use of it. And I'll tell you a little bit more about that in just a second when I tell you what some of our most recent outcomes are for this effort. And these results are from when this program started, which was July 15, 2024 through March 31st of this year is what this data is from. We haven't gotten our data up to June yet, but it's due soon, so we should have that very soon. But just to give you an idea of how beneficial these initiatives have been working in our community, they've had, since that time, 2,298 encounters with people in our community calling in on telehealth. They've had social determinants of health navigation supported by people who are helping them to with health literacy and helping them find resources. You can see the numbers there. They've had more than 3,375 touch points. And when we say touch points, it might be someone calling in to say, how can I get my diabetes medicine? They may not need to talk to a doctor. It simply may be that the navigator would have to work with them in order to find a place where they can get their diabetes medicine without having to pay for it or guiding them directly to one of our safety net clinics. It's not always a doctor that's involved, because it may not be necessary. Prescriptions are filled, 601 of those. Emergency department savings to this point has been $4,617,050. And so this is a pretty good savings we see as in terms of helping people have an option between going to the emergency room and talking to a doctor. This is some of the data that's come out. The number of people who've been diverted just from the UF Health emergency room has been about 165. How do we know that? We ask them which emergency room would they go to if they were to go to an emergency room. And that's about 17.3% of those diverted from using the emergency room for what they might see as an emergency. It might be a stubbed toe, it may be a sore throat, it may be an ear infection. This can be treated through telehealth, and it saves everyone time, and it also prevents the emergency rooms from being clogged up with unnecessary care. If we can get folks to not use the emergency room as their primary care, which is our goal, we'll be able to save our taxpayers here in Jacksonville a lot. You know, I think about the story, the young lady that I met who had asthma, and she had asthma, and she lost her job. She was going to the emergency room once a month to get her medication, her inhaler. And once she learned about this program, she was really shocked and was able to save a whole lot of money. Her emergency room bill for going to the emergency room for 9 months was somewhere around $35,000 with the x-rays and all the other treatment that she was getting. Once she learned about HealthLink Jax, she was able to then get her prescriptions by going through this pathway, and her medication was at no cost to her. And we want to be able to not just save our taxpayers' dollars. We want to save the community dollars, and to simplify access to health care for everyone. So what are we doing for infant mortality? Well, infant mortality is one of the things that's really important. It's important that we establish sustainable infrastructure to improve maternal health and outcomes. And these are things that came up when the transition committees were meeting and sharing with the mayor what we needed in our community, and the experts in this space shared this information with us. And so we added more community health workers. That's what rose to the top, so that they can provide home visits and provide resources, education for maternal health, pre-pregnancy, during pregnancy, and post-pregnancy. Partners with current projects in the community we do to improve maternal infant survival. That is our goal, to keep women healthy so that they can produce healthy babies when they deliver. So here's what we did to help support that. We funded 2 community health workers, and these community health workers have been engaged since they began, which was a year ago, with 266 women in our community. They have referred them to home visitation programs. They've worked with them and their families. They've provided training on toxic stress, safe sleep, signs and symptoms of preterm labor. Many of the women were pregnant. 81 of them were pregnant, and there were 30 non-pregnant and one male that participated in the training. They all received preconception health and safe sleep and infant mortality education. That's really important in order to have healthy babies, in order to have babies survive, and assisting women with making their appointments and helping them to make the decision not to wait until their 3rd trimester, or if there are barriers that's preventing them from getting prenatal care, helping them to work through those barriers and helping them to work through those problems that they believe are bigger than they are, so that they can get the health care that they need pre-pregnancy to save all the babies. What else can we do? We learned that there was, on the waiting list for Meals on Wheels, 2,700 seniors waiting to get a meal. And I want you to think about you and your family member if you had to put yourself on a waiting list to receive one healthy meal a day.
They know the stuff that we
because you feel like you need that to survive. I want you to think about what it takes for a senior to do that. And you've got to know that if they put themselves on that list, they really believe that they need to have a healthy meal. And it may not be because they are hungry or they don't have the money to buy food. It may really just be because they don't trust themselves turning on and off their stove because of memory issues. They're not sure if they've made some mistakes before. They're not comfortable going to the grocery store. It's not always that they don't have the money to feed themselves, but they're not able to feed themselves for whatever the reason is, whatever the barriers are. And having Meals on Wheels
Huh?
not only provides them with a meal, but it also provides them with the opportunity for another person to lay their eyes on that senior and also the environment that they're living in. And if that person needs additional resources, that person can we can make sure that they get those services that they need. So we partner with organizations that are dedicated to elder issues to coordinate and promote services that help um, older adults age independently with dignity in their homes and their community. The picture that you see on the screen is a picture of Mayor Deegan when she wanted to go on home delivery services. So we spent one day during the Christmas holidays for her to go out and serve meals to seniors in our city. And that was pretty important to them and to her. And this young lady that you see in the center with the white, we called them dusters when I was growing up, with the white duster on. She told the mayor all about her issues with her television. She was not able to watch TV. She said something was wrong with her television. And so immediately the mayor sent someone out to her house, this woman's house, the very next day to check out what was happening with her television. Can you imagine the Christmas holidays and you can't watch Christmas movies, or she couldn't watch anything? But those are the kind of things that sending these meals out to homes sometimes that they pick up. But the very next day, what we learned, it was her direct TV account. It had nothing to do with her television, but she didn't know that. And because she lived alone, she didn't have the help she needed for someone to help her with that. So she was thrilled to be able to have access to her television. Meals on Wheels is an excellent program that really does work to serve community members well. So how does this look? What have we done? There was 2,800 people on the waiting list. So far, we've served 208,887 meals. There is 1,881 enrolled in the program, and we have cut the number down significantly from 2,800 to 956 on the waiting list. We would like to have that number be 0. But we have been able to decrease the waiting list by 66%. And this is some of the survey data that came out as we were surveying seniors. Nutritional needs improved by 92%, their quality of life by 88%, and food insecurity improved by 94%. And this is from the seniors that were served. Let's take a look at mental health really quick. In the United States, 1 in 5 children and adults suffer with mental illness. And so we know the need is there, right? One of our goals is to increase awareness of 988, the 988 call center, and helping people with mental or behavioral health concerns. And we have worked really hard with 988 and the United Way for folks with mental health issues and substance misuse. It's a big problem in our city. No matter the health zone you live in, it is an issue everywhere. Awareness and education, we do realize, will reduce the stigma of mental health care. The City of Jacksonville funds 2 United Way crisis counselors to decrease the wait time for folks when they contact, they call 988. It has decreased, the last outcome was the time decreased from 60 seconds to 22 seconds in terms of how quickly the phone is able to be answered. This may not necessarily seem like a big deal, but it's huge because if a 988 call for suicide is not answered here locally, that call rolls over to the national 988 operators. If and when that happens, that operator does not know our city. that operator, the national operator, does not know the resources in our community. And their resource, their answer is to call 911. And when they call 911, that is more, it's risky when JSO goes out to see someone who is attempting suicide or feel like they are really having a serious mental health issues. We've seen the news, we know what happens. They're not equipped to do it the right way, but they are responsible to going out and checking out whatever the problem might be. If the calls can be answered here locally, we have people who are trained to handle those, to de-escalate those calls and to handle the potential suicide victim the way they should be handled. And they're excellent at de-escalating those calls. And I want to share with you just a little bit of data so far. 82% of the calls have been answered locally. And we're getting more calls, more and more calls. The more they're able to answer, the more calls we're getting. The calls have decreased by 12 seconds to 12.6 seconds. Now they're able to answer the phone instead of the 22 seconds that was mentioned earlier. 48% decrease in caller wait times. And that's really important because if a person has to hang on the phone for 10 minutes, 5 minutes sometimes, they will hang up because yet again, they begin to feel as if no one cares about them or their life. So it's important for the line phones to be answered pretty quickly. Health insurance, my goodness. We have worked really hard with enrolling community members into the Affordable Care Act insurance marketplace for insurance that they can afford. We have been very careful not to provide false information, but to enroll people in insurance that they can afford. We had phone banks in partnership with Channel 4 and an opportunity to educate people and to get them enrolled in health insurance. One of the things the mayor says often is a confused mind says no. So our initial goal was to educate community members on what the Affordable Care Act insurance is and how it works, and to work with them on what they could afford. You hear the horror stories of people getting enrolled in insurance plans that they cannot afford, and so we wanted to make sure that we did not do that. These are just numbers that compared to previous years, enrollees, and how many people we enrolled into healthcare insurance. This particular year, 2025, that number in Duval County, it was 24%. It's now increased to 63% here in Duval County, which is really important. Now, I'm sorry, in 2024, it was a 49% increase. 2025 numbers were more like 64% increase in the number of people who were enrolled in insurance. What does that mean to us? We have people who are able to pay for their health care, which saves our taxpayers a lot of money. And many of them were not enrolled because they didn't know what they didn't know. So how in the world does the Big Beautiful Bill impact Jacksonville economically? So from Medicare cuts, Jacksonville will lose $37 million. From Medicare cuts, $3 million. Medicaid cuts, $37 million. From the Affordable Care Act changes, $68 million will be lost. And for SNAP benefits, there will be a $33 million loss. So altogether, approximately what we've been able to calculate since that bill passed, $141+ million, or 14% of the city of Jacksonville's annual budget is what will somehow need to be replaced in the loss of these dollars. So what can we do? We can address the social determinants of health, the social drivers of health, to help people stay healthy. And we can use all of the tools that we have. We can reach out to community members. We can continue to work with our city council in order to develop pathways so that community members have access to healthy things, healthy food, healthy communities for walking and just healthy spaces altogether. Here are some more ways to perhaps find out what we're doing. Jacksonville.gov has a dashboard, and you can always click on that dashboard to learn. Go to jacksonville.gov/dashboards to learn what the city is doing in all of our areas of priority in terms of what the mayor would like for us to work on. So, questions? Thank you very much, everyone, for your time. I really do understand how precious time is, and I appreciate you hanging around here with me. I went a little bit over time, but I want to thank you all for your time.
Good evening, Ms. Sherman. Thank you so much. A lot of rich data, good information. So thank you for laying this all out. This is Rob Thomas from Community Health Outreach. So I'm especially interested in your information regarding HealthLink Jax. So those 375 touch points, and then the diversion for $4.6 million from the EDs. How did you get that number, that 4.6 million? That's what I'm really interested in.
Yeah, so calculating the cost, using the resources of the hospitals to share with us the cost of the average emergency room visit, considered for the average issue, and typically that involves either blood work, X-rays, other lab tests, and other lab work, perhaps if necessary, a CAT scan. And so we retrieved that information from our emergency rooms, all of them, and that's how we calculated that number.
Very good. Thank you.
Mm-hmm. Thank you. What other questions do we have? I'll turn it over to Natalie to facilitate.
Yeah. Yeah, if anyone else in the audience has any questions, please feel free to unmute and ask. But until then, we do have a few guided questions, so I'm going to hand it off to Brittany to ask one of those.
Hello, my name is Brittany. I just wanted to ask, how is technology or innovation helping to make healthcare easier to reach out, like, for everyone and more accessible to those?
Very good question, Brittany. So I would say, telehealth. Technology, when it comes to telehealth, has been really useful in a lot of ways, and we're excited to have that around, actually. And for us, that's for healthcare. That's about the biggest development in healthcare, is not having to be transported to a doctor's office or a hospital, but be able to speak to someone on your computer or your cell phone and still get good health care.
Thank you.
Yeah, Madison, did you have a question you wanted to ask?
I wanted to know about how healthcare equity has improved these past few years, and how you guys are working to implement more health policies that focus on health equity.
We're still working on improving health equity in our community, and what I shared earlier, some of the ways we're helping to impact the health equity is by providing these other avenues or opportunities for service and care for people in our community. And we believe in meeting people where they are, no matter where they are. And not always expecting them to come to us, even when it comes to providing nutritious meals for members of our community. It's okay to have a food drive, but if you don't have a car, that's not equity, right? Because many times you're expected to drive through as opposed to pick up your bags and carry them down the street. And so creating ways to sort of even the playing field for people in our community is one way that we're working at providing equity in every program or initiative that we have.
Yeah, thank you. So, unless there are any other audience questions, we'll finish off. I have one final question. So you mentioned a lot in your presentation about what we can do and a lot of the initiatives that are going on. Are you hopeful about the future in terms of access to healthcare?
Well, considering the new bill, I am concerned about the future of healthcare. Really am concerned because I'm not sure that the people in the average person really understands how this bill is going to impact health and healthcare in our communities. So I'm hopeful. I'm always hopeful, but I am very concerned about the health outcomes that we're going to have in a few years. I do realize that the bill does not take place until go into law until 2027. So we won't see it right away. We won't see the impact right away, but probably in about 4 years, you're going to see more people in the emergency room, more cost to citizens. You're going to see people who are uninsured not have places to go because, as we think about it, our safety net system, our clinics, our free and federally qualified health centers are going to be impacted. They're already facing budget cuts. So as they face these cuts, they're not going to be able to see as many people as they are currently seeing now, which means we're going to have sicker people in our communities, and we're not going to have the resources we need in order to keep them healthy or to get them healthy again. And so consequently, I mean, bottom line, there are a lot of people who are going to lose their lives as a result of not being able to get the treatment that they need to get in order to get healthy or to remain or to be healthy. So it is a huge concern of mine, but I am always hopeful. I am always hopeful that things will turn around. Things can be different, but it's something that the citizens in our community really have to realize, we have to face it, and we have to advocate for it. We have to advocate. Sometimes things get sometimes things can look so grim that we just give up and give in. And my hope and my prayer is that we will remain vigilant and do what we need to do in order to take care of the folks in our city.
Yeah, thank you so much for that response. Dennis, I'll hand it over to you now.
Natalie, I just wanted to follow up. One of the things, Lynn, you and the mayor and the committees that you and the mayor put together have really tackled the problem of indifference. One of the things that we've learned since we started doing the racial healing and reconciliation conversations is that it's indifference oftentimes that causes people to have lack of access to their needs, to have their needs fulfilled. And the kind of statistics that you're sharing with the population through the prestige of the mayor's office, I think can have a long-term impact. When you're able to show that, gee, there was a time when things were more evenly distributed than there are now, makes you want to say, well, what did they do then that's not happening now? What's happening in society? Getting this out in the open, in front of everyone, One example, for instance, this what I call the big ugly bill. Not only does it cut Medicaid, but it sets up barriers, very similar to the way certain states are setting up barriers to voting. So that if, for instance, if you don't renew your form that tells the state that you're employed, you could lose your Medicaid. A number of little tricks, cruel tricks like that I think just make it a big ugly bill. But these are the kind of things we have to stay vigilant about. And I agree with you, Lynn, that we have to be hopeful that as people see these problems and they see the impact, that they'll want to get out there and help those people who are in need. And again, I want to thank you for being with us this evening, and also thank our partnership with Pause for the Truth and our interns, particularly those you see before you tonight, who have been working hard for great town halls like this. And on behalf of the Urban League, I just wanted to thank you, Lynn, for being with us tonight.
Well, I appreciate you all asking, and I appreciate the time. Thank you.
And also a shout out to Sadia Barge, who is our intern coordinator and helped bring these great interns to the Urban League for the summer.
Great. They have been excellent.
Thank you, everyone.
Thank you all.
Thank you.
Have a great evening, everyone.
Tyrone, you hear me?
We appreciate you spending time with us on Pause for the Truth. Ms. Jocelyn Turner and Dr. Rogers Kane are grateful for your support. Don't forget to like us on Facebook, catch us live on Twitch, and most importantly, subscribe on YouTube. A big shout out to Tyrone Jackson at Call Tyrone IT Services for keeping us connected. Join us every Tuesday at 6:30 p.m. Eastern Standard Time for more enlightening discussions. Thanks, and see you next week.